Hello guys, Vanakkam and welcome to Media Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. And in this today's video, we are going to discuss about Sri Chitra Tirunal Institute of Medical Science and Technology, which is located in Kerala. Recently, they have completed the written examination and skill test also, and they have released the question paper with the answer key. But still, we are going to see the questions. We are going to discuss the question and answer in detail along with the rationale. So watch the video till the end. It will be most useful for you for the upcoming examination. So update your knowledge by keep on watching these kind of videos, revising each and every content along with the rationale will help you to succeed in the upcoming exams. So watch the video till the end, and if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Let's begin the session. The first question is, the nurse are participating in the health fair at a local mall and are giving influenza vaccine to the senior citizen. What level of prevention are the nurse practicing? See, here the keyword is influenza vaccine and the senior citizen. Okay, fine. So whenever you come across the word specific protection, related to specific protection, here what is the word related to specific protection? Influenza vaccine. So here the nurse is focusing on the infection called as influenza to the senior citizens. So here is a specific protection. So whenever you come across the word specific protection, health promotion, vaccination, contraception, hand washing technique, so these are all the things coming under what? Primary prevention. So what is primary prevention? Risk factors are there, but as a nurse you are taking some steps to prevent the risk factors to develop into a disease. Okay, so that is called as primary prevention. Okay, so here the right answer is option A, that is primary prevention. Let's see the other thing also. Secondary prevention. What is secondary prevention? See, it stops the progress of the disease and prevent the complication. Here in secondary prevention, the person is having the disease and you are stopping the progress of the disease by means of screening, yearly identification, periodic examination, case finding technique. Okay, so already there is a disease, you are preventing the progress. That is called as what? Secondary prevention. Okay, so tertiary prevention means you are preventing the level of impairment and disabilities. Already the disease is reached the advanced stage. Okay, so here you are preventing the impairment and disabilities and minimizing the suffering. That is called as what? Tertiary prevention. Okay, so on the whole, if you are saying means, which is the right answer here? There is a specific protection in the question, so you are going for what? Primary prevention as the right answer. And one more prevention is there, that is primordial prevention. What is primordial prevention? It is the prevention of the development of the risk factors. So what are the keywords you have to keep in mind here? Individual education, mass education, lifestyle modification. Recently one question asked related to this. Primordial prevention means what? What strategy you will follow here? Lifestyle modification. From the childhood, we have to keep on changing the lifestyle. That is called as what? Lifestyle modification. Okay, so lifestyle modification, if the word is coming, means it is related to what? Primordial prevention. Okay, fine. Let's go to the second question. The nursing care provided that is supported by reliable research is known as. Reliable research is known as. So here the keyword is reliable research. A nursing care you are providing with the reliable research. And here the right answer is evidence-based practice. So after the research you are getting the evidence. So it is coming under what? Evidence-based practice. Okay, fine. This is a direct question. The third question is, who has decreased mortality by improving their sanitation in the battlefield, resulting in the decrease of illness and infection? Which person has decreased the mortality by improving the sanitation in the battlefield? So whenever you see the word battlefield and decreasing the illness and infection, immediately which person should come into your mind? The lady with the lamp, that is Florence Nightingale. Fine. So here the right answer is option A, that is Florence Nightingale. And the next one is, which of the following are the 4 basic technique of physical examination? See, all the question whatever they have asked is very simple in this examination. Okay, fine. So which is the right answer here? Everyone knows that 4 basic technique of physical examination is inspection, palpation, percussion and auscultation. Okay, so which is the right answer here? Inspection, palpation, percussion and auscultation. So that is the right answer here. Fine. Both B as well as D, both are right because both are same answer only. Fine. In case if they are asking which of the following are the four basic technique of physical examination in the abdomen. Okay. So in the abdomen, first you have to do what? Auscultation. After that, you can go for what? Inspection, palpation and percussion. Why? If you are doing first the palpation and percussion, what will happen? You are disturbing the bowel movements, bowel sounds. So you cannot hear the bowel sounds properly if you are doing the auscultation in the last. So if you are examining the abdomen, first you supposed to do the auscultation, followed by that inspection, palpation, percussion has to be there. Okay. So these are all the simple things. Hope everyone would have known all these things. And question number 5, which of the following term denotes patient inability to void even though the kidney are producing the urine that enters the bladder? Here the keyword is kidney is producing the urine and the urine is also entering the bladder. But what is happening? The patient is not emptying the urine out, not voiding the urine out. So this is the keywords. So kidney is functioning well, bladder is functioning well, but the urine is not coming out. So this condition, what is happening? There is a retention of urine. That's why the urine is not at all coming out. So here the right answer is option B, that is retention. Dysuria means difficulty or painful micturition, that is called as dysuria. Oliguria means less than 200 ml of urine output. Urgency means there is an infection to the patient or the stress incontinence is there. So there is an urgency in passing the urine, otherwise fullness of the bladder is there, so urgency in passing the urine is there. Okay, so all these A, C, D, these options are not related to the question, and which is related? Retention, that is stagnation of the urine, that's why urine is not coming out. Okay, and the next question is question number 6, chain stroke respiration describe. Whenever, guys, please remember, chain stroke respiration means immediately you have to think about what? Edema. Chain stroke respiration, immediately you have to think about what? Edema. It is very common in pulmonary edema, chain stroke respiration. Okay, fine. So what is happening in the chain stroke respiration? Hyperventilation, otherwise hyperapnea and apnea. Hyperapnea and apnea will be there. Okay, so that is the thing which is commonly seen in pulmonary edema. Okay, so here which is the right answer? Option D, that is the right answer. Fine. So one more respiration is there. There are many different types of respiration. Kussmaul respiration, commonly seen in diabetic ketoacidosis. In that, the rate, that is the speed of the respiration, that is called as rate, and depth. Rate and depth of the respiration will be more fast. Okay. In Kussmaul respiration, the rate and depth of respiration will be faster. Okay. So that is Kussmaul respiration. Fine. So 6th, chain stroke respiration means hyperventilation and apnea. Hyperventilation and apnea. These type of features, characteristics will be there. Okay. And the next one is question number 7. Angle of insertion of the intramuscular injection, 90 degree. Okay. So no need for any further explanation. You all know that. Question number 8. The purpose of making mitten corners while doing bed making. See, while doing the bed making, so all these corners, okay, you have to fold it as per the technique. Okay, this is the mitten corners. You are making the mitten corners folding in a separate technique. Why we are doing that? So to prevent the loosening of the linen. You are tightening the linen by making that particular mitten technique. You are making the linen tight. If you are not doing that technique properly, what will happen to the linen? It will become loose. So what is the right answer here? To keep the bed linen secure. Okay. To prevent the cross infection, mostly you will use what? We will use the screen. We will switch off the fan so that the contact between the two patients is going to get avoided. Right. And to prevent food drop, we used to keep a pillow, and over the pillow we will make the food straight so that the food drop can be prevented. Right. But here what the question is, the keyword what you have to listen here is the mitten corners. The mitten corners have to be secured. Okay, so which is the right answer here? Option A, to keep the bed linen secure. This is the right answer. And next one is question number 9, that is one example for isotonic solution. This is also very simple question. Isotonic solution, there are three types of solution, that is isotonic solution, hypotonic solution and hypertonic solution. Hypertonic solution means more than 0.9 percentage solutions are considered as more than, underline the word more than 0.9 percentage solutions are considered as what? Hypertonic solution. Okay, less than 0.9 percentage solutions are considered as what? Hypotonic solution. So just 0.9 percentage is considered as what? Isotonic solution. So the right answer here is option A. 0.9% sodium chloride is the isotonic solution. More than 0.9 percentage is hypertonic solution. Less than 0.9 percentage is hypotonic solution. Okay, let's see the example of hypotonic solution here. 0.45 percentage of sodium chloride is an example of hypotonic solution. HYPO, hypo. Whereas 3% of sodium chloride, 5% of sodium chloride, these are all the examples of what? Hypertonic solution. Fine. Let's go to the next question. The nurse is preparing to take a pulse on a patient who is receiving digoxin. So the nurse is taking the pulse of the patient and the patient is receiving what? Digoxin. Digoxin is also called as digitalis or Lenaxin, which affect the heart. Obviously the digoxin, if you are giving, means you have to check the pulse before giving the digoxin, because if less than 60 heartbeat per minute is there, means you should not give the digoxin, because it will further decrease the rate. The action of the digoxin is to increase the contraction of the heart, whereas it will decrease the rate. Mostly it will be giving for patient who is suffering from atrial fibrillation. Okay, fine. So let's continue with the question. This assessment need to be completed prior to the medication administration. Which skill is correct when assessing the pulse of the patient? So before giving digoxin, obviously we are going to check the pulse of the patient. So which pulse we supposed to check? That is the question here. And the right answer here is C. We are going to check the heart directly before giving the digoxin. How to check the heart directly? By means of assessing the apical pulse. Whenever you are giving digoxin, before digoxin, continuously for 1 minute you supposed to check the pulse of the heart. Which pulse? Apical pulse for full 1 time. That is the right answer. Okay. Other pulse like radical pulse, femoral pulse, carotid pulse. So no need for going distal. That is distance. We have to focus on the proximal. Proximal means which is so proximal to the heart. Apical pulse is so proximal to the heart, which we can assess in the 5th intercostal space. Okay, fine. And the next one is supination. What is supination? Supination, pronation. Okay, so these are all the 2 types. In that, they are specifically asking about the supination. So supination means turn lower arm and hand so the palm is down. That is the first option. The same option they have given the second. Turn lower arm and hand so the palm is up. Turning the lower arm and hand towards you. Hand means the palm towards you. Okay. So that is called as what? Supination. If you are turning up your lower arm and hand of the palm upward direction, it is called as what? Supination. If you are doing vice versa, you are turning the hand, that is lower hand, and your palm down, that is called as what? Pronation. So here the right answer is option B. Option B. The next one is, which of the following is an indication? Which of the following is the indication for a binder to be placed around a surgical patient with new abdominal wound? Here the keyword is indication. Indication for a binder to be placed around the surgical patient with the new abdominal wound. So there is a new abdominal wound. So either it might be a surgical wound also. So there is a binder which is covering the wound. What is the indication for the binder? So here the right answer is option B, that is provides support to the abdominal tissues while coughing and walking. Obviously there is a wound. So you have to cover the wound with the abdominal binder. Even after covering the wound with the abdominal binder, while you are coughing, you are doing any kind of stressful activities like walking, so that time you have to keep your hand over the wound. After that, you're supposed to cough or do the any strenuous activity. Obviously, the strenuous activity, coughing is contraindicated, but still there is no other option that time, because cough is a natural phenomena. We cannot control the cough. In that situation, we have to cover the cover with the abdominal binder, and also you have to keep the hand over the abdominal binder, and then you have to cough. That's why after surgery immediately you have to wrap the abdominal wound with the abdominal binder. So here the right answer is option B. And the next one is, which of the following is most effective way to break the chain of infection? Hand washing or hand hygiene, wearing gloves, placing patient in isolation, providing private room for the patient. So all the options are right, but which is the priority? Which is the most priority answer we supposed to give? And here the right answer is option A, hand hygiene. Hand hygiene is the first and foremost priority answer for this question. Okay, fine. The next one is, when patient develop dyspnea, that is breathing difficulty, what is the first intervention that is to be carried out? Take blood pressure, elevate foot of the bed, remove pillow from the bed, elevate the head of the bed. So you all know that we are supposed to give the Fowler's position if there is a breathing difficulty. If you are giving Fowler's position, so what will happen? So automatically the diaphragm will go down, the lung expansion surface area will increase so that the person can breathe properly. Okay, so Fowler's position, how we can give the Fowler's position? Elevating the head of the bed. So option D is the right one. Next one, while giving oral medication, this position is essential to prevent aspiration. The same thing, we are supposed to give what? High Fowler's position while giving the medication. If you are giving other position, there is a chance for what? Aspiration. So always we have to give what? High Fowler's position. One more question will also be there. While inserting the NG tube, what position we supposed to give? For that question also, which is the right answer? High Fowler's position is the right answer. Okay, fine. The next question is, the test considered as a gold standard to detect COVID-19. For COVID-19, which is the gold standard test, recently the pandemic happened. So definitely you all know that. So which is the gold standard test to detect the COVID-19? RT-PCR. Okay, fine. And the next one is, the nurse is giving discharge instruction to a newly diagnosed diabetes patient. So discharge instruction to a newly diagnosed diabetic patient. The nurse discusses with the patient with the dietary intake should be. This is an example of which healthcare service. So here the keyword is, discharge instruction is given by a nurse to a newly diagnosed patient. So which healthcare service is this? Illness prevention, already the patient had the illness. Okay, so further prevention, already there is an illness. Okay, so further illness prevention we can take it as a right one, but already the patient had the illness, so illness prevention option should not be there. Restorative care, okay, but restorative care and tertiary care both are same. So when we will give the restorative care or tertiary care, in the minimizing the suffering, decreasing the level of impairment and disabilities, that is in the tertiary level of prevention, we will be giving the restorative care. So option B and option D is also not the right answer. So at last, which is left? Health promotion. Health promotion. For promoting the health of the patient who is suffering from the diabetes, we are giving the dietary instructions. Okay, so here the right answer is health promotion. And the next one, multidisciplinary care model used to move patient efficiently from admission to discharge. See, whenever you come across the word multidisciplinary care, from admission to discharge, immediately you have to think about what? Case management. What is multidisciplinary care? Here the right answer is option D, that is case management. Let's see the rationale. See, multidisciplinary care means a nurse who is communicating with all the persons in the healthcare team. For example, doctors, other nurses, physiotherapist, occupational therapist, dietitian, Okay, so a nurse, she's managing everything. Total management is under which person? Nurse. Okay, so this multidisciplinary care is taken care by the nurse. In the hospital, even the patient left the hospital going to the home, there also home visit, arranging the home visits, everything she is taking place. So that condition is called as what? Case management. For this question, the right answer is option D, that is case management. What is team nursing? Team nursing is nothing but same in the hospital setting. What is happening? SNO will be there, that is senior nursing officer will be there, and that senior nursing officer will be assigning the care to the patients by means of assigning the staffs. So these are all the staffs as to perform these work, these duties. Okay, and these are all the tasks you have to perform. Okay, so team means a group of nurses there and a head is there, and she is assigning the duties to the staff nurses. According to that, the nurses or nursing officer are performing the work. Okay, don't confuse the team nursing with the functional nurse. Functional nurse is different. Functional nurse, let me give one example. They are task oriented, goal oriented. They will perform one task, that's all, the work is complete. For example, they will assigned only for administering medication. They will come to the hospital, they will administer medication, then the work is complete. Otherwise, they will come to the hospital, they will check the vital signs, and the work is complete. So once the task is completed, the work is completed, then that's all. That is called as what? Functional nurse. Goal oriented or task oriented. That is different. Whereas here the team nursing, a head will be there and they will be assigning the duties to the staff nurses and they are performing the work. That is team nursing. Okay, and case management, a multidisciplinary action will be taking place in the case management. Okay, so here the right answer is option D, case management. And 19th question, the leading cause of cognitive impairment in old age is? Cognitive impairment, that is, cognitive means what? Cognitive means intelligent, thought process, memory process. The leading cause of cognitive impairment in old age is Alzheimer disease, degenerative disease, because of the old age, increasing in the age. Okay, and the next one is question number 20. A patient need to learn to use the walker. Which domain is required for learning the skill? So here the key word is domain. So there are three types of domain, you all know: cognitive domain, affective domain, and psychomotor domain. These are all the three types of domain. So answer is going to be among these three only. Okay, so here what the patient is doing? The patient is learning to use the walker. So here the motor nerve is functioning, right? So here the right answer is going to be option D, because psychomotor domain. Here the person is using the motor nerves. Motor is the one which is responsible for the movement, right? Walking is a movement, so correlate the walking with the motor movement. So you are getting the answer psychomotor domain. What about the other domains? Affective domain and cognitive domain. Cognitive domain means purely thought process, your intelligent process, how you are perceiving the content. Okay, what is the memory capacity? So that is the thing coming under what? Cognitive domain. Affective domain means feelings and emotions. For example, if you want to succeed in an exam, someone should motivate you. After that only you can succeed in that exam by preparing hardly. Your hard work and smart work makes you to do that challenging exam to become succeed by, because of what? Motivation. Motivational is an emotional thing, right? So feelings and emotions are coming under what? Affective domain. Memory, thought, intelligence are coming under cognitive domain. Movements are coming under psychomotor domain. So here in this question they are asking how to use the walker, learning to use the walker. So you are going directly to the answer option D. The next one is, the nurse is caring for a patient with pneumonia who has severe malnutrition. Okay, pneumonia is there and who has severe malnutrition is also there. The nurse recognizes that because of the nutritional status, the patient is at the risk for what? So already the person is suffering from pneumonia. There is an infection of the lung parenchymal cells, right? And along with that, malnutrition is also there. So what will happen now? Whether the pneumonia and malnutrition will lead to cardiac disease? Diarrhea, insomnia? No, it will further increase the infection all over the body and it leads to what? Sepsis. Option B is the right answer. The next one, an elderly patient comes to the hospital with the complaint of severe weakness and diarrhea for several days. Weakness and diarrhea, there is a lot of fluid loss. Okay, so it is important to assess which of the following problem initially. Malnutrition, dehydration, skin breakdown and incontinence. So loss of fluids is there. So immediately you have to focus on what? Dehydration. So option B is the right one. The next one, when assessing the lower extremity for atrial function, which intervention should the nurse perform? Lower extremity atrial function, whether the blood flow is adequate in the lower extremity, arterial blood flow is adequate in the lower extremity, that you have to check. How you will check? You will be palpating the artery and you will check. So which artery you supposed to palpate? Option A, medial malleoli. Option B, Allen's test. Option C, Homan's test. Option D, pedal pulses. And here the right answer is option D, pedal pulse. You are supposed to palpate the pedal pulse of the foot, dorsal pedal pulse of the foot, and you can check adequacy of the arterial blood flow. Homan sign for DVT patient, you are supposed to do the Homan sign. What they will do in the Homan sign? They will just flex the leg and they will dorsiflex the foot. While dorsiflexing the foot, if there is a pain in the calf muscle, then the person is having DVT. What is the treatment for DVT? They will be giving low molecular weight heparin. It is coming in the commercial form like enoxaparin, and followed by that warfarin tablet they will administer. And for Allen test, they will be checking for the adequacy of ulnar and radial artery in the hand. Hope everyone knows about the Allen's test. Before doing the radial artery puncture, for example, arterial blood gas analysis has to be done. So they have to puncture in the radial artery, means first they have to check the adequacy of blood flow to the hand, arterial blood flow to the hand, by compressing the radial and ulnar artery. Okay, after that they will be just releasing the ulnar artery alone. After releasing ulnar artery, immediately there is a adequate filling of the blood over the hand. Then it shows ulnar artery is functioning properly, there is no block in the ulnar artery. Then you can go for the ABG in radial artery or any kind of puncturing in the radial artery. So in order to find out the blood flow, you are doing what? Allen's test. And the next one is medial malleoli. It is also the one which is there in the foot only. There also we can check the artery, but still where we have to give more preference, pedal pulses, we have to check more, we have to give more preference. So that's why we have selected option D. Question number 24. While auscultating the patient lung, adult patient lung, the nurse hear loud bubble sound during inspiration that do not disappear after the patient cough. Which finding should the nurse document from the lung assessment? 4 options they have given here: rhonchi, coarse crackles, sibilant wheeze, pleural friction rub. See here in this question the keywords are loud bubble sound. So once during inspiration and that does not clear or disappear after the patient cough. So whenever you come across the word bubble sound, it immediately you have to think about what? Crackles. Okay, so here also the right answer is what? Coarse crackles. There are 2 types of crackles, that is coarse crackles and fine crackles. So fine crackles and coarse crackle, the difference is here low pitch sound will be there in the coarse crackles. Okay, and the sound will be more clear when compared to the fine crackles. Okay, and rhonchi means large airway. In the large airway, secretions will be there. Here also the sound will be same like crackling sound, bubble sound, but still large airway is affected, and when the patient cough and split the sputum out, that time the sound will subside in the rhonchi. Underline the word, the sound will subside in the rhonchi, whereas in coarse crackle the sound will not subside, even though the person clear the throat, cough and split the sputum out, but still what sound will be present? The bubble sound is continuously present, means the person is suffering from crackles. And what about wheeze? During expiration, the wheezing sound will be there because of the obstruction of the airway. Okay, so that is called as what? Wheezing sound. Here during expiration, the wheezing sound will be there. Okay, it is a high pitched sound. And pleural friction drop, because of the loss of lubricant between the visceral and parietal pleura, what is happening? Pleural friction sound will be there during expansion and contraction of the lungs. During inspiration and expiration, pleural friction rub sound will be there. That is crepitus sound will be there. Fine. The next one is the patient effort to manage the psychological stress is known as. The patient can manage the psychological stress is called as, it's a direct question, answer is coping. And we will be continuing with the other questions in the next video. Please keep on watching our video. If you have any doubts, anything has to be included, points has to be included means please comment us in the comment box so that we will be adding that point also. Keep on doing the revision. Revision is always important for succeeding in the upcoming exams. Okay, fine. Thank you very much, guys.